Well, welcome everybody. Thanks so much for being here. My name is Danielle Alexander, and I just wanted to give a few housekeeping details. We have a one-pager with all the bills and information over here, as well as a list of everyone's names with spellings and a couple of pertinent details. And we're going to ask if everybody can just hold questions till the end. We should have a good 10 minutes at the end where we'll be able to answer questions. So with that, I'm going to turn it over to Mark Griffith, who is our president of OCAP, it's Oregon Coalition for Affordable Prescriptions.
Good morning, everyone. I'm excited to be sharing our 2019 legislative agenda for OCAP today. For those of you who don't know, OCAP is a nonprofit organization and a coalition that consists of patients, advocates, health plans, health provider groups, and labor unions, all dedicated to lowering prescription drug prices in Oregon. At OCAP, we believe that to truly lower prescription drug prices, we must start at the source, the price set by pharmaceutical companies. Prescription drug companies are the most profitable companies in the world, with profits surpassing even the tobacco and alcohol industry. Meanwhile, Oregonians are struggling to keep up with skyrocketing prices. Too many people are being forced to go without the medications that they need. We're proud to be championing 7 bills this session, including House Bill 2689 and Senate Bill 409, which deal with prescription drug importation from Canada, House Bill 2658, which deals with 60-day notice before prescription drug price increases, legislative LC 3018, which deals with advertising price disclosure, HB 2753, 2754, and 2755, all which deal with increased access to generics and biologics. Our legislators gathered here will be explaining these bills in a little bit more detail. But first, I'd like you to hear from Les Rogers, who is here for today from Roseburg on behalf of his daughter, Gloria.
Thank you for having me here today. As Mark mentioned, I've come today on behalf of my daughter, Gloria, who is 5 years old. My daughter has a seizure condition called West syndrome or infantile spasms. IS is a serious seizure condition that causes massive developmental regression, often leaving children with cerebral palsy, brain damage, unable to eat, and even leads to death. IS is treated by a drug called ACTH that was invented in the 1930s. Mallinckrodt, a drug manufacturer, bought the drug that treats this condition and steadily raised the price from just $40 a vial to now over $45,000 a vial over the last 10 years. Mallinckrodt also bought the rights to and then blocked a less expensive $100 a vial synthetic form of ACTH called Synacthin. This treatment is used in Canada and they blocked it from coming to the market in the United States. Hospitalization and treatment drove my family to the edge of bankruptcy, and my daughter was left tube-fed and suction dependent due to the treatment delays fighting over the drug price. Vigabatrin is a second frontline drug for infantile spasms. Lundbeck is the drug company who makes it. And they have raised the price from $1,500 per month to over $26,000 per month in the last 3 years. In Canada, Vigabatrin sells for only about $60 a month. These exorbitant pharmaceutical prices in the U.S. have left thousands of U.S. children to seize uncontrollably for days while waiting for these drugs that are readily available in Canada and other countries, but due to price gouging, are not available in the United States. This price gouging has led to thousands of children to suffer the same fate as my daughter. Severe brain damage, cerebral palsy, reliance on tube feedings, and many have died. Most of the surviving children require significant medical supports costing untold millions of dollars a year, and many of them would be far better off if we were able to get the medications to these children when they needed them. The pharmaceutical industry does not care about these families or these children. They only care about lining their pocketbooks. I'm here today to ask my legislators to support swift passage of the drug importation from Canada, 60-day advance notice of price increases, and other bills being supported by OCAP. Because the market is broken, drug companies are getting away with highway robbery, and children like my daughter are dying without the medication they need. Thank you for your time.
Thanks for being here today, Les. Ann Nielsen is another Oregonian who has been affected by the pharmaceutical industry's outlandish price gouging. Ann joins us all the way from Madras today to share her story.
My name is Ann Nielsen. I'm a retired registered nurse, and I suffer from chronic dry eye syndrome. My doctor prescribed Restasis 14 years ago to slow the damage being caused to my eyes. Unfortunately, I cannot take my full dose because it is so expensive. Restasis is manufactured by the drug company giant Allergan. A full dose of Restasis costs me more than $2,062 per year out of pocket after insurance pays $5,157. I've waited years for it to become more affordable. It is important that I take the drug regularly so that I can keep my corneas healthy. Without proper treatment, my vision could be seriously damaged. My husband must take Xarelto to prevent life-threatening blood clots at a cost of nearly $5,000 per year. This is in addition to our other prescriptions. As a nurse, I know there are lots of other stories out there. I discovered scores of patients taking half their prescribed doses or skipping doses due to limited incomes, causing poor health outcomes. I testified last year to this legislature in support of House Bill 4005, the Prescription Drug Pricing Transparency Act, and I'm so glad they listened. Now I'm here to ask them to take it further to control drug prices. Oregonians need immediate relief. And there are several good ideas you're going to hear about today, like prescription drug importation from Canada and 60-day advance notice of prescription price increases. That will give us that relief. Last year, I started to buy Restasis from Canada because there it cost $1,137 total. That's 1/6 of the total U.S. price. Allergan is fighting against importation in Oregon, proving they will stop at nothing to protect their profits. I urge my representatives and all legislators to please support legislation that will help Oregonians like me and all the senior citizens out there, not billionaire pharmaceutical company CEOs. Thank you.
Thank you, Ann. OCAP is here today because we believe that there are very real solutions that will make immediate differences in prescription drug prices for people like Les and Ann. Here to talk about the first of 5 bills are Senator Dennis Linthicum from Klamath Falls and Representative Rob Noce from Portland, who are the chief co-sponsors of both House Bill 2689 and Senate Bill 409, allowing for importation of drugs from Canada.
So thank you all for being here. My name is Rob Noce. I represent Southeast Portland here in the legislature, and I'm very pleased to be down here with my colleagues in the Senate and the House trying to address this issue again. We know that the price of medications is one of the growing problems we face for affordable health care, and that problem starts with the source of who sets the price, the pharmaceutical manufacturers. It's time that we do something, and I'm very delighted to be here with Senator Linthicum all the way from Klamath Falls, 2 ends of the state coming together to try to do something to address the price increases.
Thank you, Rob. My name's Dennis Linthicum. I'm the state senator for District 28, which is down in the Klamath Falls area. You hear that all the time. It includes Lake County and all the way up into Crook County, too, including all of Crook County. And I'm happy to be here this morning with regard to these bills that are in front of us. They're interesting attempts at making a difference for the citizens of Oregon and where they can purchase drugs, opening up access. As you'll remember, we teamed together to sponsor House Bill 4005, which was focused on transparency to empower the citizens to find out more information about the products they're using. And this is very similar in terms of we would like to empower the marketplace by opening up drugs that are across the border to our north, coming directly from Canada. We purposely avoided other countries to make sure that we were focused on a Canadian, North American, modern economic capacity that could produce, manufacture, and restrain the illicit activity that everybody associates with drug importation. So thank you for your time this morning. Rob has a few more comments.
Just the bills are very simple. They basically require the state of Oregon to set up a mechanism in Canada that would allow for legal, safe drug importation into the United States. And the great thing about these bills is, assuming we can get them passed, we only need to get permission from the federal government. It's not a waiver that's required.
Additionally, as you may be aware, I got into this little kerfuffle. It's a legislative kerfuffle, if you want a real quote, because my daughter and I have both been insulin-dependent diabetics since our teenage years. So I've been using insulin for the past 45 years, and this product, if you'll look at the price charts that we have access to within the OLIS legislative information system, you will see these prices that go up and up and up at an annual growth rate that far exceeds what we call consumer price indexes. So at some point, you either focus on price gouging or you focus on opening markets. I'm all about opening markets and giving the consumers the freedom to purchase drugs where they can actually make their own choices and be responsible for their own health in their own lives. So thank you for your time this morning.
We're very lucky that we can set this up with another country like Canada.
Thank you, Representative. Thank you, Senator. Now we're going to hear from Myra Huck, a young woman from Northeast Portland who would like to say a few words about how prescription drug importation from Canada would affect her.
Hello, my name is Myra Huck. Thank you so much for having me here today. I'm 31 years old and I have Crohn's disease, which is an inflammatory gastrointestinal condition. There are several medications that help alleviate my symptoms, and all of them have outrageous prices in the United States. Humira is the main prescription used to treat Crohn's. AbbVie, the maker of Humira, just raised the price an additional 9.7% this January. AbbVie makes $12.6 billion in profit on this drug alone. My medical costs exceeded $300,000 last year before insurance when I took Humira injections. Now I'm unable to afford them. I now take 4 pills a day of Lialda. That's $1,181 a month before insurance. I don't have the option of skipping a dose to save money because it would set me back even further in my treatment. I also do chemotherapy monthly to keep my symptoms at bay. My type of chemo costs $14,000 annually. It hasn't worked so well so far, so I'll eventually be required to switch to a more expensive kind. In addition to these expensive, I also have 3 different types of cream I use because Crohn's causes skin and lip problems. I take mupirocin, triamcinolone, and hydrocortisone. That's an extra $100 a month for all 3, and I often run out sooner. I can't skip the creams because I get eczema to the extent I can't bend my elbows. If the exfoliative colitis gets bad, I can't move my lips enough to eat. Right now, I'm working as a nanny so I can get assistance with my health care. I'm well educated and intellectually capable of having a career other than nannying, but having this disease and having to spend so much money on treatment keeps me from meaningfully contributing to the economy. I should not have to live like this at age 31. These prescriptions only cost pennies on the dollar in Canada. When pharmaceutical companies look at me, all they see is the money they can make. We must fix the systems, and we can start by allowing prescription drug importation into Oregon from Canada. Thank you.
Thank you, Myra. I'm State Senator Elizabeth Steiner Hayward, representing Northwest Portland and Beaverton, and I'm here today on behalf of my constituents and Oregonians like Myra to support prescription drug importation from Canada, as well as HB 2658, which will require drug manufacturers to provide at least 60-day advance notice of any intent to raise prices beyond a certain threshold. It's so important for families like the Rogers family and for people like Ann and Myra to have time to plan and seek new medication if their prescription prices are going to increase. The positive experience of California in rolling back and better controlling drug price increases since they passed the 60-day notice requirement last year, gives me great hope that we can reap similar benefits for Oregon consumers. And on a personal note, I would add that I've testified publicly often the medication that I'm on for my multiple sclerosis started at $5,000 a month in 2007 when I started taking the medication, and is now $17,000 a month 11 years later, with a drug with no new clinical indications. So I'm confident that my colleagues and I can, along with a lot of help from fellow legislators and the great folks from OCAP, can get this done for Oregonians. One of these colleagues is Representative Andrea Salinas, and who's championing the remaining bills on the agenda. Andrea?
Thank you, Senator. Hello, as Senator Steiner Hayward mentioned, I'm State Representative Andrea Salinas representing Lake Oswego and Southwest Portland. I'm here for my constituents as well, and also for the countless seniors and other Oregonians who depend on prescription drugs and who have been crying out for relief. In addition to the bills discussed by my colleagues, 3 additional bills this session would help control prescription drug prices, including a legislative concept I have, 3018, which mandates that manufacturers disclose the wholesale drug price in any prescription drug advertisement. HB 2753, 2754, and 2755, which work together to streamline access to more affordable generic drugs and biological drugs. Together, these bills will start to rein drug manufacturers in. For the past year, we've been hearing from thousands of Oregonians that requiring transparency from prescription drug companies, like Ann, is important, but it's just not enough. Too many people are going without their medications or splitting their pills in half. We have a huge opportunity this session in 2019 to make a difference in reducing prescription drug prices for Oregonians. I'm really eager to work with my colleagues to make that happen. Thank you.
Thank you so much, Representative Salinas. So with that, we're going to open it up for questions.
Representative Nose, I'm interested in the Canada bill. I mean, me too. Can you just take me through, I'm a little naive on this, what the difference is between the permission and the waiver, and are there other states that have done the same thing?
So this bill is passed in Vermont, and they are still in the permission getting process. So a waiver. Oh, yeah, you want to come? Okay. So thanks for your question. This bill has passed in the state of Vermont, and they are in the process of getting permission, making an application. I think it's to the Health and Human Services Secretary at the federal level. And a waiver is where you have to get an exemption from following a certain law. You have to get an agency to allow you to do that, similar to what we do for the Oregon Health Plan and our prioritized list. This is not a waiver process. All we have to do is basically get the nod from the Trump administration and the Health and Human Services Secretary. Hopefully Vermont will be the first one and pave the way. And then when we pass our bill, we'll be able to get in line.
You're confident it'll pass?
Well, you know, we're just getting started, but I know that, so I want to say yes. We know that prescription drug affordability is a big problem for commercial health insurance, for the Oregon Health Plan, for state workers that are on PEB or OEB, and here's an actual way that we could reduce costs.
So who in the Trump administration has to give permission?
I knew you were going to ask that. I should know who the Health and Human Services Secretary is,
Alex
but
Azar.
the senator knows.
And is there any question in your mind whether the permission would be granted to Vermont?
I would never want to question what the Trump administration would do or not do on any given day.
Representative, following up on this, the Trump administration has proposed that a law or decree, whatever it would be, and Jeff Merkley agrees that prescriptions could not be sold in the U.S. for any more than they're sold in foreign countries. Are you working in concert with anything that's being done nationally?
That's a great idea. I've not heard about that. You know, I got this idea from a legislator in Provo, Utah, who's been trying to figure out how to do this. And then luckily the state of Vermont passed it. So, but that sounds like a great idea that maybe should be is being tried at the federal level.
Representative Nose, I know other states, I think Maine, allowed their people to buy prescriptions from Canada, and there have been, I think, some issues with counterfeits and people
Sure.
not getting the actual drug, and in some cases actually getting hospitalized. If something like that happens, who does the liability fall on?
So here's the beauty of this bill. Okay, this isn't going onto the internet and buying drugs in Canada on some internet source like you can already do. You don't. This is about the state setting up a system where we purchase drugs at the Canadian price in Canada. And so then we're buying from the same manufacturers that are selling to us in the United States, but we're purchasing it at a Canadian price, not an American price, and we're doing it in Canada and then importing here. It's a completely different system. So I don't worry about the safety of purchasing drugs from Allergan that they're selling here in the United States or drugs from Pfizer that they're selling here in the United States. Doing it in Saskatchewan or Ontario or whatever province might take us up on it.
How would that logistically work once the state bought the drugs? How would they sell them?
They would have to set up a contract with Providence or Moda or with PEB or OEB and just import them in and stock their pharmacies.
So, and what about like Walgreens and CVS? And
I assume a Walgreens or CVS could take advantage of this too, but I haven't figured that out yet.
I have a question, unless you were going to say more on that. No, I have a question for Ms. Nielsen.
Okay, we'll let her come up. Okay.
You're a registered nurse and have been around people with presumably all sorts of conditions requiring drugs. What have you seen in your own life, and particularly in Central Oregon, where are prices higher there than they are in the metro area?
I don't know. I've never compared prices in the rural areas to the metro area. I know there's people in Madras that will travel an hour to Bend if they have a Costco card, Costco pharmacy, to get drugs there. We do have a Safeway pharmacy in Little Madras, and I have Hometown Drug, which I love, and I don't blame the pharmacists. And PMBs haven't been mentioned at all, but those are the middlemen that oftentimes also affect our outrageous prices.
What is that abbreviation?
Yeah. PBMs. I said PMBs, I'm sorry.
What does that stand for?
Pharmacy Benefit Managers. Yeah. And they're supposed to be helping patients, but that doesn't seem to be the case. If you start studying the track of the drug companies, Big Pharma, and then these middlemen, and then our local pharmacies. But as a nurse in the community and doing home health and hospice and in public health, I saw it probably more than in the hospitals because, of course, people are taking their medications there. But going into people's homes and discovering, even them cutting in half the strips as far as that they use to check their insulin. Some of that has changed because there's new technology out there, but a lot of people not taking their medications as they're prescribed, either half doses or skipping doses or waiting till the end of the month.
So you've seen this. What is it like for you being in that position?
I'm angry. I was educated by the sisters at Sacred Heart in Eugene, and that's not what medical care is about. And we can argue that Big Pharma isn't part of medical care, but yeah. So it was all about caring for the patient and filling their needs and helping things be affordable. It wasn't about greed. So.
And for any of the members, House Bill 4005, when that passed, it sounded like this is sort of building off of the progress you made there. I'm just curious if you have seen any sort of impact on pricing from that bill.
The tip was 9.97.
Yeah.
I saw you react to that too.
Senator Linthicum and I both served on the task force that was set up by House Bill 4005. Of note, one of the compromises we reached on that bill is that the provisions for manufacturers to report at 10% increases or more won't go into effect until July 1st of this year, and that was to allow us to do that task force and figure out what else we wanted to do. Senator Linthicum, Representative Noble, and I are working very, very closely on an omnibus bill with all the recommendations from the task force, and those are available online if you look in OLIS in the 17-18 biennium under task forces, and that full report is there, and we urge you to look at it because it has a lot of really robust recommendations along the entire supply chain. Ann's point about the PBMs, about wholesalers, we have to attack this at the entire supply chain. I would just point out quickly that 9.7% is deliberately right below 10%, and 10% a year means that the price doubles in 7 years.
On that note, the entire supply chain is extremely complex. The list price for pharmaceutical products since 2007 is up by 256%, something like that. I could get you the real number if you'd like to follow up. The net price to pharmaceutical manufacturers is only up 54% since 2007. The variance between those is all the other players. Everybody in the federal system, everybody gets an opportunity to take some of the cream off the top. And the individual what we're doing is trying to put power back into the hands of the patient, the beneficiary, the consumer, those individuals, because they need to have the ability to control their own health care, make decisions that are appropriate for their lives and their choices. And so what 4005 focused on in 2017 was empowering consumers with information. This is broadening the scope so that we open the borders and give them the opportunity to purchase drugs that are cheaper in Canada.
And, no, it's okay. On the supply chain, you mentioned, I know reimbursements are also part of that kind of convolute how expensive a drug really is for insurance companies and for pharmaceutical companies. Is that something you're also looking at targeting?
There are discounts, there are reimbursements, there are buybacks, there are rebates. There are, there are so many various categories. We will be focusing on holding hospitals and insurers and pharmaceuticals and all of those individuals in some form or another. They have to understand what they're contributing and how they're contributing to the problem that impacts the consumer. Because the consumer is the one that we're here today discussing, these individuals who have a product like Senator Steiner Hayward was mentioning. In 2007, it was $5,000. Today, it's $17,000. It's just an astronomical increase in the price of a product.
I think it's important to point out that the cost of prescription drugs affects every Oregonian regardless of whether you personally take a prescription drug or not, because the cost of your health insurance premium is going up precipitously, not because of, there are other places we can control costs in the healthcare system, but a significant percent of the increase in health insurance premiums is due to pharmaceutical pricing, which is largely outside the control of almost anybody who's purchasing health insurance, whether that's a business or an individual or the state, for that matter. And as we look to restrain growth in state government, as we look to help increase wages for Oregonians, every dollar that's spent on health insurance premiums is a dollar that doesn't go to wages, it doesn't go to program in the state. It's a huge issue for every single Oregonian, regardless of your family's personal health situation.
Well said. Thank you.
I have a question from Mr. Rogers. This has got to be tough. How do you deal with this as a family?
Well, you know, I've advocated a lot. Some things that happened at the federal level I didn't dive into, but the Federal Trade Commission did fine Mallinckrodt $100 million a couple years ago. They responded by increasing the price an additional $10,000 to $15,000, depending on when you look at per vial, when you look at the timing. But it's frustrating. For my daughter, I deal with it on a daily basis, trying to care for her. Thankfully, we have a lot of family support. Bless Oregon for enacting the 1915 K waiver and the K plan that supports individuals that experience developmental disabilities. But that's through K plan support, through our family, and all of us working together. You know, I'm going to testify in a little bit, and you might hear a little bit more. But that all of that together is how we make it through.
How does it affect your daily or weekly or monthly financial decisions?
Well, the good news for Gloria is thankfully she was able to overcome this seizure condition. This is a seizure condition that tends to stop around the age of 2. She's 5 now, but the consequences are lifelong for her because of the brain damage that was caused by the uncontrolled seizing for days. We were waiting for the medication, waiting for the approval from insurance so we could get it. That's why I'm here today, you know. And there's other parents right now in Oregon. There's some not far from where we're standing right now that I am trying to help through the process right now that have infants that are 6 months old, and trying to get the medication and keep the supply.
So the inability to get medication when you needed it and enough medication created lifelong consequences for your daughter.
Yeah, and you know, there's a personal cost and there's also the social cost of the increased cost to all the medical care that's required for these children, because we can't get the medication in time. Okay, thank you.
We're late now.
That's all the time we have. Thank you all so much for being here. Thanks for all the great questions, and look forward to getting these bills passed this year.